Welcome to the presentation video of PBL Group 8. Today we would like to present our findings and learning issues about the disease Mycobacterium tuberculosis. We first begin with the case history that we got. In a zoo called Kipang Zoo, the oldest elephant was found dead with low-grade fever and chronic weight loss. Soon after, another relatively healthy elephant was also found dead, followed by a rhinoceros and 5 deers. Some mahouts and zookeepers were also symptomatic. So what is Mycobacterium tuberculosis? It's a re-emerging infectious granulomatous disease in animals and also in people. It's caused by the acid-fast bacilli of the genus Mycobacterium, and it can have both acute and also chronic presentations.
For these cases, there are a few common clinical signs that can be seen in an animal. Such as in an elephant that is infected with tuberculosis, they may show signs of weakness, weight loss, exercise intolerance, and also coughing. For deers, they are mostly infected appears healthy. However, they may be emaciated, exercise intolerance, and have coughing and nasal discharges. For rhinoceros, they may have nasal discharges, coughing and sneezing, diarrhea, they may appear lethargy and inappetence, and they also have tachypnea.
Now we'll move on to the clinical signs of tuberculosis in humans. So the general symptoms of tuberculosis in humans involve a lack of appetite and weight loss, a high temperature, night sweats, extreme tiredness or fatigueness. And when tuberculosis affects the lungs, you would see symptoms of a persistent cough that will last up to at least 3 weeks, which will bring up phlegm and may be bloody, as well as breathlessness that gradually gets worse. Tuberculosis also can affect regions outside the lung, and some of the symptoms that you might see would be persistently swollen glands and as well as abdominal pain. However, these type of infections are not common.
So let's proceed to the prevention and control of tuberculosis. So among elephants or the infected animals, complete history can be obtained before the importation of animals. This will be able to help to minimize the chances of introducing a new disease or bringing in tuberculosis to the premises. So next, routine tuberculosis testing can be done. For example, like the Mantoux tuberculin skin testing or the antibody blood test. So the general health of the animal should be aware of as well, and targeted testing should be done when animals are suspected to have infected with tuberculosis. So for the control, firstly is the isolation and quarantine of infected animals, the travel ban for the animals, and also the utilization of the proper PPE by the staffs, especially while handling the infected animals. Next, proper disinfection of premises should be conducted as well. However, the use of high-pressure hoses should be avoided in order to minimize the creation of aerosolized droplets within the enclosures. So, among the humans or workers, the prevention that could be done is to do routine tuberculosis screening for the employees, especially those who work closely with elephants or infected animals, and routine education of staffs in zoonotic disease prevention, and also the clinical symptoms of active human tuberculosis infection. And this will be able to help to minimize the spread of disease. And also, HEPA filters can also be used to increase ventilation of the premises. And the traveling to high-risk areas should be avoided as well. Lastly, vaccination program can be conducted. So for the control, it includes the quarantine of infected personnel, the utilization of proper PPE during close contact with infected personnel, and also proper disinfection of premises and also dormitories of the workers.
Alright, so let's move on how to handle tuberculosis outbreak in terms of One Health approach. So in human health, there are many agencies which are involved to curb the outbreak of tuberculosis, which are the Ministry of Health, Ministry of Education, Ministry of Defense, Ministry of Home Affairs, as well as Human Resources. They serve a role to improve diagnosis and contact tracing in people diagnosed with tuberculosis, as well as to reduce transmission from human to human. They are also involved in collaborative approaches to increase awareness among the community regarding the tuberculosis. As for environmental health, there are also many agencies involved, which are the Occupational Safety and Health Administrations as well as the ecologists. They help by implementing environmental controls to prevent the spread and reduce concentration of infectious droplet nuclei of Mycobacterium tuberculosis in the environment. As for the animal health, the agencies that are involved are the Department of Veterinary Services as well as the Ministry of Agriculture. They serve by helping to minimize the risk of transmission of tuberculosis to the public as well as to develop policies and guidelines on how to counter tuberculosis outbreak. They also implement joint interventions from various sectors to collaborate with.
Next is diagnosis methods. There are several diagnosis methods can be done on this case. For example, bacterial culture, virus isolation, fecal culture, blood smear, CBC and serum biochemistry, and also take water source sample to detect contamination. Next is differential diagnosis. There are two parts. The first one is acid fast bacteria, for example like Mycobacterium tuberculosis, Nocardia species, Rhodococcus species, Sarcocystis, and also Brucella species. The next one is granulomatous lesions, for example like Mycobacterium tuberculosis, Brucella species, and also Nocardia species.
Moving on to postmortem examination. Postmortem examination include gross lesion and histopathological lesion. Gross postmortem examination of an elephant with Mycoplasma tuberculosis shows several pulmonary granulomas that are more than 12 cm in diameter. Caseous material in bronchioles, lymph node enlargement, especially the tracheobronchial and sublumbar lymph node, and fibrotic area of the lung. While histopathological lesions show a classic granulomatous lesion of the affected tissue, central caseous debris and mineralization, and multiple acid-fast stain negative.
I will be presenting on the treatment of tuberculosis on both humans and animals. Firstly, for humans, the common medication that are used to treat tuberculosis are isoniazid, pyrazinamide, rifampin, and ethambutol. Treating tuberculosis is also considered as a long-term treatment. In the latent stage, treatment needs to be carried out for 6 to 9 months. For active tuberculosis stage, treatment needs to be carried out for 6 to 12 months. And for drug-resistant tuberculosis stage, treatment needs to be carried out for 20 to 30 months, and the patient will most probably experience side effects of the drugs too. Moving on to tuberculosis treatment for animals, we can carry out isolate, test, and slaughter method to stop the spread of disease. For elephants in this case, we can also try using drugs to treat the animals. We can treat using first-line drugs, which are isoniazid, pyrazinamide, rifampin, ethambutol, and streptomycin. If the animals experience multi-drug resistance, then second-line drugs can be used, which are amikacin, ethionamide, quinolones, and capreomycin. The route of administration of drugs in elephants are oral or rectal routes, and in treating tuberculosis in animals, close monitoring of the patient is important to better observe if the animals are experiencing any side effects of the drugs.